little bit of a bend in her knee. You don't want her straight. Okay. If she's sustained a knee injury, okay, we're looking for a collateral, so MCL or LCL. The tape job is exactly the same that we're going to do. However, if I have somebody who has an acute injury, like for example my baseball player who just blew out his MCL, no chance am I going to put this tape on him and let him go play. Okay? Not going to happen. This is not a strong enough tape job to actually help that much.
Take the place of that medial.
To take the place. If she's got an active knee injury right now, she's going to be playing with metal. She's going to have a metal brace on or something that has metal stays in there to protect that. The place that we use this tape job is in rehabilitation, or when we're pretty confident that this person can go out and play, but they need a little bit of psychological boost. Okay? They need to have something that says, I'm okay. There's something there. I'm good to go. All right? It's just not strong enough. Typically, there's a lot of different tapes that people use. Beav does this one a lot with our wrestlers. Okay, our wrestlers, they get wrenched on day in, day out on their knees. Their knees are garbage. A lot of times when they go out to practice, they're still able to practice pretty much 100%, but they need just a little bit of support. We'll throw this on. Usually we'll use Elasticon, that heavier brown stretch tape. If you really don't want any movement at all, you might put down the strap tape, the heavy strap tape, but you won't give it all. Sometimes we use a combination. Beav likes to use the Elasticon and then trace it with white tape. Gives it just a little bit more strength. In practice, it's okay. In a wrestling match, probably not the greatest thing to do to send your guy out onto the mat with this big thing on his leg. What's his opponent going to do?
He's going to go right after it.
He's going to go right after it. He's going to sit on it. He's going to ride time, and you're done, right? So tape on the knee can actually be a detriment to them in some sports. If she's playing baseball, it's not going to matter. Softball, it's not going to matter. But in a sport like football, soccer, wrestling, where there's contact, if you know that guy's hurt, you know, it's not right, but it is the nature of the thing. Okay? When we do this tape job, we're going to create an additional ligament on that side. Okay, so if it's MCL, we're going to do it on this side. If it's LCL, we're going to come on this side. We're going to go upper mid thigh to the bottom half of the calf. We're going to try and take advantage of our body shape. Okay, so the cone shape here. The thigh, once you get up, most people, and yours are actually stay coned all the way up. Most people kind of hit a point and then it plateaus out. Stays kind of the same at the top. We want to kind of get to that point where it's kind of the same. We don't want to be down here where it's fairly cone shaped. This does have to anchor to the skin, otherwise as soon as she runs, the whole thing just shrinks down on itself. It's kind of like the Achilles. So we're just going to come down here. We're going to pre-wrap it in. The pre-wrap is mostly there just to prevent irritation as this moves back and forth on our skin. Okay. Right in there, we're going to do 2 anchors at the top. Remember, this isn't exactly circular, right? So you're going to kind of try and take advantage of your angles a little bit. So 2 at the top, 2 at the bottom. Okay. This is where knowing where your anatomy is helps. Okay. Those ligaments sit right at joint line. Okay. So I need to create my X. Okay. I'm going to create my X right down through here. Okay. So what I'm going to do is I'm going to kind of pick my angle a little bit. Okay, these shouldn't wrap all the way around. This shouldn't be like this. Okay, we want this to be fairly, not straight up and down, but we want to kind of like that. Now, if we go straight on top, we've only covered this much. But if we overlap, we go from here to here. Okay? So, I'm maybe a little bit back on that one. Okay? And I'm going to cover this one about right there. Now I've covered twice as much area. You see how that works? Tie it down. Okay. A couple of things you want to be careful of. The patella still needs to be able to move, so we don't want to be coming across the patella. We don't want to hinge on it too much. This one right here, this is borderline too close, maybe. Maybe I needed to do this a little farther back. But we want to have this X right over where that ligament is. Okay, if you did an MCL, do the exact same thing. Just be on this side of the leg. Okay. Any questions about this one?
Is there ever any advantage to doing both? I mean, if they are weak just all around, to do both sides?
You could, but you're going to start having some pretty significant restriction in your mobility. So, the only time I will put this on somebody who's actually going to go out and play with it is, and that has an active injury, is in conjunction with a brace. Sometimes I will put this on as some added protection.